identify the subclinical cases. I try to act when the patient is in the subclinical state. What PSM has taught us. So PSM told Park 10% is a clinical, 90% tip of the iceberg is clinical, 10%, 90% is this. So I thought, why should 90% of people are fighting for this 10%? Let me go deep, I am there. And being an MD medicine, that's always an advantage. You enter in, okay, I will do my clinical practice only, but my target is subclinical. And in that also subclinical endocrine. Nobody wants to talk about them. So nobody is talking about subclinical hypothyroidism, nobody is talking about subclinical and hypoandrogenism, subclinical growth hormone deficiencies, I will do it. Then subclinical metabolic cases, obesity, prediabetes. You have prediabetes, lifestyle change करो जाओ. अरे कराएगा कौन? 2 बार खाओ, 55 मिनट खाओ, 55 मिनट वेट करो. Suddenly a keto diet person come. अरे मैंने सिर्फ अखरोट खाए, मैंने बादाम खाए, मैंने घी पिया, मेरा डायबिटीज गायब हो गया. Suddenly, why? Because we doctors are not, right? So physicians have to understand it, but who will talk? How many diabetologists are sitting today and telling a patient what you should not eat? Acha, go to a dietitian. But in reality, doctors are the best dietitians, right? They can tell, at least for the medical food I'm talking about. Right? So who will do it? Diabetologist is not going to do it. People who are sitting with hundreds of patients outside will not do it. We will do it. Then comes subclinical nutritional deficiencies. We all do this assessment. B12, vitamin D, vitamin E, folate, iron. Find out. Anemia, patient, hemoglobin 10. Why don't you do serum ferritin and iron? Do it. Because by the time hemoglobin is deranged, the mood changes will have happened. Believe me. To live, hemoglobin is more important than mood, right? So if I have low iron, I will divert all the iron to hemoglobin synthesis. And I will compromise on my other things, including the mood. So even before a patient is having anemia, mood disturbances do happen. And sometimes HB is 11.5, 11.6. Patient is having iron deficiency. So in PSM it is said that hemoglobin is a predictor of iron deficiency. No. Borderline low hemoglobin with even a slightest of a mood issue. Look for iron, you will find it low. Then comes subclinical toxicities. Now here come the chelation and all these things. But again, when you start claiming it, it becomes a problem. So let them study more and more. A lot of studies have been published for chelation in the US. It has been granted also. Federal funding has been granted for ECP and chelation both. So that is a good sign. So lead, iron, aluminium, arsenic, all these poisonings are very common in India at least. Because we make food in pressure cooker. So pressure cooker, most of the pressure cooker are aluminium made. You are using every other utensil of steel, but pressure cooker is steel or aluminium, and majority are aluminium. The kadhai, majority of them are iron and others are aluminium, right? In India I am talking about. Our plumbing work is all lead oxide, so that there is no rusting, but the lead is coming in, right? Groundwater is having, like mainly in Odisha, Calcutta side, lot of arsenic. And groundwater still is the main source of water in India. Even in your part, central India also, arsenic is too much in the water. Clear? So lead ho gaya, arsenic ho gaya, aluminium ho gaya. And then comes the powder, lot of bhasm coming in, energy powders coming in from Ayurveda, from this, containing lot of heavy metal inside, even some homeopathic medication. Because you say that take 6 pills, but they are so good. वो रुकता ही नहीं आदमी 6, 8, 10, 12, 15 इतना मीठा मीठा होता है वो. So that overdosing do happen. So heavy metal toxicity, sometimes nothing is coming up, like nothing is coming up in angiography because it is more distal and a microcirculation problem. Angiography is normal, and here the role of ECP is there. Same as heavy metal toxicity, everything is normal, only hemoglobin is a bit low. Low means not anemia. 11, 12, 11, 12, 11, 12. Everything is normal, all hormones are good, everything is good, all tests are good. CRP is also okay, homocysteine okay. Problem is heavy metal. And you find it. Then once you found it, either you do yourself or ask somebody who is expert of chelation what can be done. But again, don't go overboard. But should be considered, right? So we should know about everything. थोड़ा थोड़ा सबके बारे में पता होना चाहिए. Subclinical lifestyle disorder, which is the biggest lifestyle disorder today, social jet lag. We all are living in social jet lag. We are working in this artificial light. We are working late in the night. Forget jet lag. We are in social jet lag. We are awake when we should sleep, and we are sleeping when we should be awake. So we are going to have those problems of jet lag. We will talk in when we come to melatonin. Okay, sleep issues. I think every third person today is having a sleep issue. Subclinical mood disorder. Not every mood disorder is depression. India lost the match. I was not feeling good, but I was not depressed. I was low that time. Got it? So every feeling low is not depression and does not need antidepressant for long term. That has to be dealt with. But when this lowness happens frequently, then you have to talk about subclinical depression. For everything you are feeling low. And who will identify it? We will identify it. Okay? Anxious, panic, and feeling isolated. People who feel that I am isolated, I am not, I don't belong to this place. They are our patients. Subclinical stress associated disorder, not able to cope up. From students to people working in corporate. गांव से आया है, corporate में अच्छा job मिला है, not able to cope up initially. Who will support that one? He can't go to a psychiatrist. He is not going to a counselor. He's coming to you. You are taking care of him or her. Interpersonal issues, marriage issues, friendship issues, job issues. So other than psychiatrists, who is handling it? Physicians are not handling it. Diabetologists are not handling it. Cardiologists are not handling it. Either a psychiatrist will handle it or a psychologist will handle it. 90% of psychologists are not doctors, right? They have done psychology, MA or something. Then there is a huge vacuum of people to handle them and make them understand. That also we'll talk later on. That is our job. Then comes musculoskeletal disorder, autoimmune, cardiovascular. This is true.